beat around the world around beat around.
Hello everybody. I am Khaled Ali and now you are listening to Peter Round Poor's the best radio show in the whole world, supported by CI Center for European Initiatives and the Erasmus Plus program. So as you know, today is Thursday and this is the time of my rubric Health Comes First. So today we will speak about one of the most famous chronic diseases all over the world. Yeah, that is called diabetes mellitus. And also we have a lot information to say about these diseases, yeah, and how we manage and deal with this, and how we prevent this disease from the beginning. So, but first I want to play some cool music. So stay with me, and we will come back again. So enjoy. Hello, welcome back again with me in my rubric Health Comes First. So, as I told you before, that today we will speak about one of the most common chronic diseases all over the world, which called diabetes. So, diabetes is a chronic incurable disease, and managing diabetes can be complex, requiring careful attention to diet, exercise, blood glucose levels, and the proper use of medications. Managing diabetes requires patients to make significant and lifelong changes in lifestyle, and it has been clearly established that the incidence and seriousness of diabetic complication and the incidence of type 2 diabetes can be increased if the disease is properly can be decreased if the disease is properly managed. Um, these changes require a lifelong commitment from the patient. Healthcare professionals can provide information and guidance, but much of the burden for the day-to-day management of the disease must be on the patient. And to successfully live with diabetes, patients need information. They must understand the disease of diabetes. They must understand the importance of the therapeutic interventions, and they must follow treatment recommendations. If they don't have the proper information and adhere to the treatment plan, they will not control the disease. The disease will control them. So, the responsibility of nurses and other healthcare professionals is to ensure that patients who have diabetes receive the information they need to self-manage their disease and the support they need to apply this knowledge. The incidence of type 1 and type 2 diabetes is already very high. The incidence of both is rapidly increasing, and this trend is expected to continue. So, nurses have traditionally taken a lead role in diabetes education, and as the number of people with diabetes increases, this responsibility is sure to grow. So let me tell you in like briefly way about the pathological process of diabetes. You don't need in-depth knowledge of pathological process of diabetes, but you should have the information that is essential for successful self-management of the disease. So, let me like define the diabetes in briefly definition. So, diabetes is a chronic disease that affects the body's ability to control blood sugar level. If it is not properly treated, diabetes causes a high blood sugar level and chronic high blood sugar, which is called hyperglycemia, and also can cause serious complication. Also the word of insulin. Insulin is a naturally produced hormone that is used to carry glucose from the blood to the cells and the tissues. Without insulin, glucose can't be used by the body and it accumulates in the blood. So, what is the meaning of glucose? Glucose, commonly called blood sugar, is the end product of the breakdown of many of the food we eat. So, glucose is one of the primary sources of energy for the body. Also, I wanted to tell you that is like some kind and some types of diabetes. The first one is called type 1 diabetes. Type 1 diabetes is an autoimmune disease caused by genetic, susceptibility, and environmental triggers. It's characterized by pancreatic beta cells destruction and the lack of insulin production. The onset is typically during childhood or adolescence, and type 1 diabetes account for from 500% to 1000% of all cases of the disease. Also, there is a type called type 2 diabetes. Type 2 diabetes is characterized by insulin resistance and relative lack of insulin production. It also caused by an interplay of genetics and environment, but in this form of the disease, the environmental factors that increase the risk of developing type 2 diabetes have been clearly identified and many of them are modifiable, like obesity, hyperlipidemia, hypertension, and sedentary lifestyle. Type 2 diabetes accounts for approximately from 90-100% to 95-100% of all cases of the disease. The onset is usually in late adulthood. Also, there is a type from diabetes which is called gestational diabetes. Gestational diabetes occurs during pregnancy, and the incidence of this form of the disease has been estimated to be like about 9.200%. But with good prenatal care and lifestyle adjustment, the condition usually resolves. So, what happens if if diabetes didn't treat or manage it well? Like there is chronic complication can be happen, because the most common chronic complication of like diabetes are specific to the disease, like chronic hyperglycemia. And diabetic nephropathy. This is related to the nervous system, and also diabetic nephropathy. It's related to like kidney function, yeah. And the diabetic nephropathy, it's related to nervous system, and diabetic retinopathy, which related to the eye, and the diabetic foot ulcer also. So, patients shouldn't be expected to understand this complication in great detail. However, diabetic patients should be educated so that they understand how serious these complications are and how they can be prevented. So, I still have some information about diabetes mellitus, and I will discuss you like most of questions are common about diabetes, and I will answer you about these questions. But before this, let me play some cool music and we will come back again. Hello, hello, welcome back again in my pre-health comes first, supported by CI Center for European Initiatives and Erasmus Plus program by European Union. So, as I told you before our break, that there are some common questions about diabetes, so let me answer for this question. So, some people say that no one in our families has ever had diabetes, so why can we get diabetes? I want to say, did you know that you can develop type 2 diabetes without having any genetic predisposition to it? Because recent studies show more and more college-age students starting their after college lives with with type 2 diabetes as a result of poor diet and physical fitness while at school. And there is like risk factors for type 2 diabetes include high body mass index and little or no physical activity, maybe family history of diabetes and some of other reasons. Also, some of people asked like how would we know that we have diabetes? Some signs of diabetes include being very thirsty or hungry, feeling very tired, blurred vision, tingling in the hands or feet, and sores that are slow heal. Also, some of you maybe ask like, I don't feel sick and my weight is totally fine and skinny is good, right? I want to say that skinny doesn't always equal healthy. While the association between having a high body mass index and diabetes or pre-diabetes is well established, weight alone is not the only thing that can be put you at risk. Big skinny fat risk factor for diabetes, neglecting exercise, regulating weight through food choices alone. Um, Also, when you are get this disease, so maybe some of you asked, now I get this disease, so what I can do to prevent diabetes? So let me say that maintain healthy weight, lose weight if your body mass index is greater than 25. Also should do like exercise regularly. Go with friends, take a dance class, relax with yoga, find something you like so you will stick with it. Recent studies show that upping your lean muscle mass may lower your odds of developing pre-diabetes. Also, you can choose lean and low fat foods, eat unprocessed high fiber foods like whole grains, fruits, and vegans. Use fat free or low fat milk and yogurt. Also, you can eat as little added sugar as possible each day. Also, you should use less fat or oil when cooking and baking. You should also eat healthy, moderate amounts, like watch your portion sizes, especially when eating out. You can also make your meals last at least 20 minutes. Add satisfying protein-rich foods to all meals and snacks. Divide your plate in half and fill one side with vegans. So, I want to say it's necessary to incorporate management in the quality of care and in the control of diabetes. So, that patient, the family, the community, and the health professionals actively participate in an integrated way, which can become a factor of effectiveness and efficiency. It should be understood that the transmission of information on the pathophysiological aspects of diabetes and its complication, it's not the only and exclusive thing to be treated in an educational program. It's imperative to promote education and health promotion by promoting self-efficacy and in the context of a clinical condition that can be improved by empowering the individual to achieve effective self-management. The person with diabetes faces a tough challenge, taking special care of his or her own health and life. Therefore, some commitment to themselves demands and requires personal care to provide the body with the necessary requirements to meet a diet, adherence to therapeutic, medical, and metabolic controls, and exercise physical activities together with the support of the family, the caregivers, and educators in diabetes. So we reached today to the end of my rubric. But before say goodbye and ending my rubric, let's listen to the last song. So enjoy with this one. Hello again. So today we reached to the end of my rubric. I hope that you are enjoy with it, and I wanted to say thanks for your listening, and see you soon next week on Thursday at 1 p.m. with Bulgarian time. So bye bye.